One of the most important things that we want to help you with today is learning about what fibroids actually are and what they are not. Fibroids are very common. As a matter of fact, 70 to 80% of women in their life will develop fibroids. A fibroid is just a benign tumor inside the uterus, which grows unusually large when compared with the uterus. Fibroids are not cancer, and that's one of the most important things that we want to educate you on. Fibroids are not early cancer, they don't become cancer, and they'll never turn into cancer. Fibroids are simply a benign growth within the wall of the uterus. This benign growth can cause a variety of symptoms, which we'll talk about later, but again, it isn't a cancer. Fibroids can range from very, very small all the way up to several feet in diameter. Most women have, on average, 6 to 8 centimeter fibroids. Fibroids in and of themselves are essentially the same no matter where they're located within the uterus. However, you may have heard that you have a submucosal or a subserosal fibroid. That's simply describing where the fibroid is located within the uterus. A submucosal fibroid is a fibroid that's located just underneath the inner lining of the uterus. An intramural fibroid is a fibroid that's located within the body or within the wall of the uterus itself. A subserosal fibroid is a fibroid that's under the outer lining of the uterus. So the different types of fibroids can be submucosal, intramural, or subserosal, depending on where they're located within the uterus. You may also hear that you have a pedunculated fibroid. That simply is a description of how the fibroid is attached to the uterus. And in some women, the fibroid hangs off the edge or the inner lining of the uterus. It's nothing concerning, it's simply just a description of your type of fibroid. A lot of women ask, why do I have fibroids? The truth is, we don't really know, and we're not sure why some women have fibroids and other women do not. We do know that fibroids can be hereditary, and they've actually shown that female twins have a higher rate of fibroids than twins who are not identical. We also see that women who have grandmothers and mothers with fibroids are more apt to have fibroids themselves. Certain women of different ethnicities will have increased risk of fibroids, such as African Americans, which have probably an 80% risk of having fibroids at some point during their life. We also know that progesterone is one of the stronger indicators of fibroid growth. And as a matter of fact, fibroids have higher progesterone receptors on them than the rest of the uterus. Women who have had multiple pregnancies, multiple babies, are protected from fibroids because their hormones have changed during those pregnancies. The typical age range for developing fibroids is in a woman's 40s. During that time, a woman's estrogen begins to decrease and the progesterone takes over. As we mentioned, fibroids are very progesterone sensitive. So as that progesterone increases, fibroids tend to grow during a woman's 40s. The average age of diagnosis for fibroids is 43 years old. If you look at medical studies in women, certainly they can be diagnosed much younger if they're causing symptoms, or even older, but the average age is about 43 years old.